A lot of you have heard me talk about my best friend, Nicole. My best friend lives in Boston. She happened to wind up working at Mass General in Boston. So my good friend, who has always gotten her skincare for free, I have the top skincare lines in the world, and I can send her whatever she wants, and I make sure her skin looks good. She has beautiful skin anyway. And she just says, well, I just use what Chrissy sends to me. So I called her, and I said, Nicole, you haven't ordered anything in a little while. Are you okay? And she said, oh, I don't want to make you mad, but I have found a new line at work, and it's amazing. My skin looks amazing. And I was like, now, wait a minute. This isn't okay. And so she came, hey, Sam, can you come and put the Derm Young presentation up for me? So she came down, and I said, bring some of that stuff when you come. I've got to see what this is, because I'm sure it's a scam. Well, no, it wasn't. It was a wonderful product. So I got a few samples myself, and some of my staff tried it, and we just loved it. So Sam and I made a trip up to meet Serena and Yang and get to know a little bit about Derm Young, and decided that it was an absolute wonderful fit for our practice. So I want to introduce Serena Almaraya to come and tell you a little bit about Derm Young.
Thank you, Chrissy. So I just wanted to thank you. So I wanted to thank Sam and Chrissy for inviting us to this event and to get to meet all of you. And I'm glad the rain is over, so you were able to make it in more easily. My name is Serena Almaria. I am a dermatologist at Massachusetts General Hospital in Boston, and a developmental neuroscientist and skin biologist at Harvard Medical School. Sorry, I'm not trying to hit you. And in that capacity, I had the pleasure of meeting one of my greatest friends and now colleagues in and partner in this, and really my inspiration, Dr. Yang Brooks. And so Yang, I shouldn't say Yang, Young is going to come up and actually talk with you after I just get to tell a little story, so I get the fun part. And Young is an incredibly talented and very funny, vivacious young lady who really inspired and developed this product and the product line. It is her brainchild. And so I will say she's got amazing credentials. She has a PhD in genetics and molecular biology from Medical College of Georgia. She was, when we met, she was also an instructor at Harvard Medical School and the skin biologist working on skin cancer and pigmentation and cell renewal, which she's going to tell you more about. And now she's an adjunct faculty over at Vanderbilt University, but she's really also just an amazing person. And so this story, the story of Derm Young, which I love to share, is really one of a couple of things that I find, again, inspiring, just like I find Young. And so the story of Derm Young started one day when we were at lunch in the research area of Mass General, and Young said to me, Serena, I've kind of been watching my mom age a little bit, and I want to help her find, her youthful glow. And she said she was going to make a cream for her to help her attain her beauty. And her mom is also, it's no surprise that Young's amazing, because her mother is also amazing. She's a head pharmacologist and pharmacist at a major hospital in China, and also was raising Young and taking care of a family, and just a busy woman who didn't have as much time to take care of herself. And Young said, well, I'm going to make a gift for her for New Year's, and this will be something to help revitalize her skin. And as the skeptic that I am, I said, okay, good. Try it. Just see what happens. There are thousands of products out there, and nothing's really going to work. But it's a nice thought. It's a nice sentiment. And so Young crafted what ultimately became the Youth Essence that you guys all have a sample of. And she told me, again, at lunch, several months later, that she'd done it. She'd given it to her mom as a gift. Her mom loved it. She had started to give it to her friends, and they all loved it too. And Young asked me because I see patients at Mass General every week, and she said, would you start to give it out to whoever, the patients, the nurses, whoever, would want to try it? And as I said, I am a skeptic. I am approached by some of the biggest companies and the biggest names in skincare all the time to try to promote or try, new products. And I usually honestly say no. I just decline because I'm not a big believer in many of these interventions. But when Young asked me, I said, okay, well, I'll give it a try, because I know she was an impeccable scientist and has a lot of integrity, and she wouldn't tell me to do something if she didn't really believe in it. So I gave it to my nurse, Nicole, which is not actually Chrissy's friend, Nicole. It's a different nurse who's kind of like me, a skeptic and a little bit of a complainer, and has never been happy with any skincare line. And she also has access to anything she wants. Doesn't matter what it is, prescription level even. And she tried it, and when I saw her the following week, she said, whatever this stuff is, it's amazing. My acne is better, I feel better, my skin glows. And she actually had, at that time, Nicole, that's when Chrissy's friend Nicole came over and said, Nicole, what are you doing? And Nicole told her about Derm Young, the Youth Essence, and Nicole, Chrissy's friend, started using it, and within 2 weeks stopped wearing makeup and was getting comments about how she always had a glow. And we started giving it out to all of the nurses and all of the front desk staff, and the same thing was happening. People were coming back to me saying, can I have more? I need more. Because Jan gave me a couple samples. I gave them out and they were done. And I kept having to go back to Young and say, could I have more? And so it really developed into something. And I went from being a complete skeptic to being a true believer, in this, in the Derm Young, what has become the Derm Young line. So, one thing that I really want to impress upon you is that Derm Young was certainly derived out of Young's love for her mom, but it has all of the scientific innovation and integrity that that comes from the fact that Young is a skin biologist, and I am a skin biologist and a neuroscientist and somebody who sees this day in and day out. So, we believe in results in the dish and in the patient. And so, this has been thoroughly tested and thoroughly evaluated and designed specifically to meet the needs of the people who use it. Okay, so when you have a lot of these products, you'll have a product that's designed just to change your pigmentation or just to increase your collagen or your blood flow. But all of these things go hand in hand. And it's I actually love that we were talking about PRP today, because the reason why PRP works in most cases is because it is essentially taking your own natural ability to heal yourself, and it concentrates it, in your skin, and it allows the growth factors that your skin needs and is used to repopulate the youthful look. And that is actually how Derm Young was designed. So Young very carefully crafted and extracted natural elements that would harmonize and work together to essentially answer the calling of whatever your skin's needs are. And she's going to go into how she did that. But it is a reason why Derm Young is so special. And it's also something that was designed to work with many of the interventions that you may pursue here at About Face or in your kind of dabbling in these different types of facial rejuvenation efforts. And then I also just like to emphasize the fact that Derm Young is, it was as important to our interests as well as our friendship, because I just learned so much about Young and her ability to craft these things. And you'll see when you ask her questions, she just knows everything when it comes to how to really, I think, stimulate the skin. She's a pretty amazing skin nerd. And so, I always laugh because I love to show this painting because, it seems so weird, but the truth is, if we could, every one of us would want to jump into that fountain of youth. If there was one thing we could do that was simple, just jumping into a pool of whatever that essence is and develop our 20-year-old selves, we would, right? That's why we're all here. And so, I've never been a believer in the fountain of youth, but I will tell you that I think this is one of the closest things to it. So when we're talking about skin aging, it's important to recognize how your skin ages. And there are many aspects that lead to facial aging. Okay, and Christy went through some of that. There's muscular loss of muscle tone, there's loss of bone, but the skin itself is incredibly complex. And you'll see that as time goes on, as we age, by the time you're in your 30s, you have a much lower rate of cell renewal and turnover. You may notice you get a cut on your legs when you're in your 30s or your 40s, and it takes an extra week just to heal from that if you were 5, it would have already been healed 2 days later. Right? So that leads to a dull appearance, a loss of radiance, slow healing. There's also a loss of collagen and a buildup of elastic tissue that leads to wrinkles and deeper furrows. An altered lipid barrier, so that's not something people really think about, but your lipids, the kind of like fatty layer that seals your skin cells, which are the bricks, so the lipid barrier is the mortar, and that starts to degrade and lose its integrity over time. So, what that ends up making you susceptible to is sensitivity, little rashes, makeup that used to be fine, but now irritates your skin or feels harsh when you're exposed to it, inflammation, eczema, and also just dehydration. And that is something that we all see in terms of dryness. And then finally, there are kind of the cumulative effects of photo damage, so UV-induced and even visible light-induced changes in pigmentation in your skin. So you can get brown spots that look like essentially what we call sunspots or lentigines. You can get light spots that are essentially your pigment cell saying, I don't have what it takes anymore to make you look like you have an even skin tone. And then pink spots, which are usually signs of significant enough damage that you have either abnormal blood vessels, so not the ones you want because they're not really functional, or it's precancerous. So when you're trying to promote and rebuild your skin to obtain that youthful or natural glow, there are many things that you need to address. And again, this is where things, really effective laser treatments or the non-surgical facelifts tries to address all of these different issues, and so does Derm Young. So we try to increase cell renewal. We try to restore that lipid barrier and allow your skin to hydrate normally. We also, in Young, I'll show you some examples of this, but part of what makes Derm Young so different than a lot of the topical skincare lines is it actually reduces inflammation that allows your skin to heal and start to glow, while it's also promoting collagen, reversing dyspigmentation. And one thing that I always put in here that right now is not part of Derm Young, although we do hope to go in that direction, but having good sun protection is incredibly important, because there's no point in spending money on all the things that you spend money on if you're not going to protect your skin from the UV damage, because that's actually what causes a lot of the changes that you'll see. So there are many anti-aging, treatments and interventions that you can pursue. The simplest and the most common is using some type of topical formulation. And that can be in the form of, over-the-counter moisturizers, retinols, and prescription retinoids, which tend to strip the skin but attempt to boost collagen. Hyaluronic acid, which again holds water and tries to plump areas, and then bleaching agents to change the pigment or lighten pigment abnormalities. There are also injections like the neurotoxins, the dermal or fat fillers, fat transfer. There's also the PRP, which I actually should have put on here. And finally, there are lasers and light sources, and those come in so many different flavors to try to hit different layers of the skin to either lighten, brighten, plump, resurface, all of those things, as well as radio frequency and cooling devices, to try to tighten up the fat or loose like fatty tissue, like sagging fatty tissue underneath the chin. And finally, there's also surgical facelifts. So one thing that I like to point out about the development of Derm Young in light of all of these interventions, as I said, all of these interventions, or most of these interventions, particularly the the injections, the lasers and surgeries and PRP, they try to harness your own body's ability to heal in order to reproduce young skin. And that is actually, again, as Young will tell you, what Derm Young is trying to do as well. And it works, I think, in harmony with a lot of those devices and interventions. And I was amazed to learn this when I had been at Mass General about 3 years in, that whenever our cosmetics department gives a talk, they like to point out that 70 to 80% of all cosmetic interventions, and it doesn't matter what you're talking about, Botox, any laser, almost any laser on the market, they were all developed at Mass General. And so, and by people that we know and we work with and that are in our meetings. It's crazy, right? I mean, I thought they were kidding. And then I realized the royalty stream that comes into to Harvard because of that. And the nice thing about that, though, is that these are the people that, as we were kind of developing our careers, and even now as we're developing Derm Young, these are the people we work with. Like, we know what they're going for when they're trying to ablate a certain, or to change a certain molecule in your skin. And Derm Young was crafted around those technologies. So I think, quite frankly, that's why all the nurses came back to me and said, give me more, because Young took that into account. And over the course of Derm Young's development and our friendship, every lunch, we started having lunch more often. And we started talking, well, no, you can't do this, you have to do that, and you have to put this in there, because we know that that's what, Dr. Rox Anderson, who made fractional ablative laser, was really targeting. So we know that molecule's at a vulnerable state. Let's try to boost that. So there's a lot of science that, Young's not even going to be able to talk about that goes into it. So that we address, and I'm not going to go through all the limitations, you can read them, but essentially we can address the limitations that, just the fact that you put hyaluronic acid in a facial cream does not mean it's actually going to work, because it comes in many different forms and it has to actually penetrate. And so we do hope you do have samples in your bags and your gift bags today. And we hope that, as you use these products, you can actually see and feel how they were developed differently in terms of the effects that you will experience. And I think with that, I am going to turn it over to the wonderful Dr. Brooks.
So hello, everybody. It's great to be here today. And we just finished a session this afternoon, and it's great to see all the beautiful and youthful faces. Everyone looks at least 10 years younger than their actual age. And I have to point out that, as Serena mentioned, I went to school here in Georgia, where I fell in love and married a Georgia boy. So having a spa event here in Georgia feels like a homecoming party to me. So welcome, everyone. So as I'm standing here looking around, again, I see beautiful and youthful faces, blessed by good genes, probably, but most definitely pampered by all the modern technologies about face skincare provides. And I believe many of you probably think you are all set with all those technologies. You don't care about skincare products anymore because you're already getting great results. But what if I tell you, using Derm Young can help you see even greater results and see good results within a much shorter time? Would you be interested? So one most apparent reason you need a skincare product to go hand in hand with your treatment is apparently those treatments are not for daily use. Even though I know Sam would love to have you in every day, 3 times a day, even the weekend, it's just not practical. I know. Because many of the treatment actually create wounds, and you need time to recover and heal the wounds. So, in between your sessions, you still need some products to keep your skin properly hydrated and maintain the benefits. And you probably will argue with me. Over the years, I have used so many skincare products with little or no effects at all. And nowadays, in the industry, I mean, there are so many hypes. Stem cells, growth factors, superoxidant. You really cannot tell if they are just hypes or they actually will work. And now you're becoming very savvy about all those ingredients in the creams and lotions, and you know about all those paraben, the PEGs. You really don't want to put those potentially harmful ingredients on your skin. So we share your concerns, and we understand your frustration. And it happens that we know a thing or two about the skin. That's why we developed DermYoung iGenesis collection. So iGenesis collection is designed to be a safe, efficient, and effective skincare solution for people of different ages, different skin types, different gender, and different races. It sound too good to be true? Let's find out. I need to forward one page. So you heard scientists, dermatologists, plastic surgeons, the world-renowned dermatologist, the nation's best plastic surgeon, but you never hear about skin biologists. So what do skin biologists do? As I would like to put it, dermatologists like Serena, when they sit in their clinic, examine patients' skin under dermoscope, so skin biologists like me will sit in the laboratory and examine their cells under a microscope. So when I used to work in Mass General Hospital, every week the plastic surgery unit will send us discarded tissue from people going through tummy tuck, breast enhancement or reduction, and a surgery facelift. So when we get this skin, we isolate adipose stem cell. You probably heard about this stem cell, which is commonly used in regenerative medicine, and some use them as a dermal filler to give you a natural boost, whatever you call it. And then we peel off the epidermis, get the keratinocytes, which are the cells to, renew every month and build your skin barrier. And then we also get a dermal fibroblast. That's the cell responsible for producing collagen, elastin, and all those material for the extracellular matrix and give you the tightened, plump the look. So over the years, working with those different cells and in different healthy condition and also in skin disease like atopic dermatitis, hyperpigmentation diseases, and the skin cancer. We know a thing or two about them, how they work independently or how they interact with each other and function as a whole. So we carry this view in the science that skin functions at its best when everybody does its job, to the development of Derm Young. So our product is designed to target every cells in your skin, not just the epidermal keratinocytes or just the dermal fibroblasts. It has to target epidermis, dermis, the blood vessel, and the fat. So let me cite two simple examples. Everybody has a hydration cream, whatever, serum in their medicine cabinet because we need hydration, especially in the winter. So what do these creams do? One thing nobody ever tells you is there is no blood vessel in our epidermis. So how do water get up there? Well, the blood vessel carries the water, and the water has to diffuse from the dermis to the epidermis. There's also a protein called aquaporin, which is a channel to transport the water to the epidermis. There's only this two way. You cannot just pour water onto your skin and it will get in. Otherwise, we'll be so fat on a rainy day, right? So most brands which do hydration cream, they don't tell you this. What they do is they will use occlusive reagent, like silicone compound, and then to seal your skin so the water will not escape. You will not evaporate. So make you feel, oh, I'm hydrated. It's just to, just give you a false feeling that you're hydrated. Actually, just reduce the water evaporation. So what do? We know one thing we can do is stimulate the microcirculation, so more water will be transported to your dermis and then possibly be diffused to your epidermis. Another thing we do is water can be lost through inflammation. When inflammation takes place, all the cells release the cytokine, and the water aquaporin channel will move up and then transport more water to evaporation. So we'll suppress that. And another thing is, yes, hyaluronic acid is a great ingredient, but we use the super small hyaluronic acid. So instead of forming a film on top of your skin, it will go into the topmost layer and then absorb water over there. So that's our way in comparison to what other people normally do. So this is example number one. And then number two, so probably a lot of you use some anti-wrinkle cream which claim to boost your collagen production. However, you know, a lot of those creams don't really work. Probably you have this experience in this. And why they don't work, I'm sure most of the companies did their laboratory testing and then show their secret ingredients actually can stimulate those cells to produce collagen. However, when you apply those creams on your real skin, it's a totally different story. Why? First, it has to be able to penetrate and get deep enough to the dermis to reach those cells. That's number one. It's a hurdle. It's a big hurdle. And number two, what if the cells, yes, we get active ingredients, but we don't have sufficient blood supply to transport all those nutrients to build the collagen? So that's another hurdle. And do they think about it? Probably no. So they only want to find the ingredients to stimulate cells, but they don't consider if you have enough elements to build the protein. So that's the difference between Derm Young and those other brands. When we develop a product, we think everybody in the cell, everybody in the skin, I'm sorry, because when everybody works, it's the best. That's the big difference. And as I mentioned, so everybody recognized that the medical treatment you are getting here is more effective than the topicals because it creates a wound, really reach deep into a dermis. And so we acknowledge that, but we're trying to get as close to those medical treatment as possible. How? So as Serena and Chrissy mentioned many, many times, and Chrissy in her past presentations, when we create a wound that activates your cells, and our skin's innate capability is to repair and heal, you know, as our first defense against the environment, the pollutant, the toxins, and the bacteria. The skin really has to heal as quickly as possible so those bad things will not get in. So that's their innate capability. So you use the laser, the light, or the heat, by radio frequency, or the microneedling, the mechanical injuries, they create this wound, which sends a very strong signal to tell the skin cells there's a problem, you need to repair. And you know, many of the customers in their 70s, they do a ablative laser. And after that, they look like they're in their 40s. Why? Because your stem cells wake up and do their job. And that has two meanings. First, oh, your stem cells are still there. And they can do their job. And second, why they are not doing their job normally? What are they doing normally? So as we age, let me back up 1 second. So our skin functions based on the communication between different types of cells. You know, when we need collagen, the signals will be sent to blood vessel, hey, we need more nutrient. Hey, the dermofibroblasts, you need to get ready to produce. And as we age, this communication breaks down. And the cells start to neglect each other and then don't hear what is needed and they don't hear the calls for help. And only when the signal is strong enough, like the wound, will make them realize, oh, there's a problem and we need to work. So that's why the medical treatments are so good, so effective, because the trauma is strong enough. But can we do it in a non-invasive way or even safer way by topicals? Yes. You just have to know what signals to send them. And what signals are they? They are in these boxes. And another thing you may notice, even in the same spa with the same practitioner, the same machine, and the same setting, some people people are seeing varying degrees of benefit. Some people feel, oh, this treatment is great. I see great results. Some people will think, it's so-so, I do okay. And some people will say, I don't see any results. I may need another treatment. And if you go to the website Real Self, and then for a certain treatment, some people will, yes, recommend. Some people will say, no, never. So why everybody are seeing different outcomes with the same treatment? Blame it on genetics, blame it on lifestyle. Actually, the answer lies within yourselves. So the cell variability and also the cell activity really dictate the outcome. And so how can we help in here? For example, so this treatment, even though they are called non-invasive, it doesn't mean there is no injury. Your cells will die, especially the fat cell, which will burst like fireworks at a degree of 42. That's why the radio frequency keep the temperature lower than 42. Well, that's the epidermal level, but down there, who knows? It will be higher than that. So you will lose some cells after you go through the treatment. Say if you have 100 cells before the treatment, after the treatment, you may have 70 remaining cells. And then you are relying on those 70 surviving cells to pull through this and to regenerate. What if before the surgery, before the treatment, you have 300 cells? That means you will have more cells pulling through the trauma, more cells producing the collagen, so you will have a shorter recovery time and a better result. So that's what Derm Young provides. Like we show in this picture, well, we just try to keep the scientific part as short as possible. So this is 2 patients in their 50s, and then when we treat their cells, we isolate their keratinocytes, and then when we treat their cells with the Derm Young Youth Essence for 7 days, and all these big dots are a cluster of cells. So normally in their 50s, the proliferative capability of your cells are not so great. So after 7 days, you can see marginal cell clusters. However, when you are treating your cells 7 days with the Youth Essence, you see a significant increase of the cells with proliferative capability. And then we can increase the keratinocyte proliferation, the dermal fibroblast proliferation, as well as induce the collagen production. So in this way, when you walk into your treatment, you may have 300 cells there. And after the treatment, with a 30% loss of the cells, you still have 210. So with that cell number, you have shorter recovery time, and you will see an effect not in 8 weeks, but probably in 4 weeks, in a shorter time. And in real person, that's the outcome. So this is a 64-year-old white male using Youth Essence once a day for a month, and you can see a great reduction of his sunspot, much lighter here, and it completely disappeared here, and a much smoother wrinkles, crow's feet here, and the smoothened wrinkles here. And we also observe tightened pores on this patient as well. And like I said, when we produce the product, we take every aspect into consideration. So an anti-aging product actually can treat adult acne as well. Dr. Thompson was talking about how stress can induce acne, rosacea, and all those not so desirable problems. And this lady is 25 years old, and she used Youth Essence for 1 week, and her acne was almost completely cleaned up, and her acne scar and the pigmentation was greatly reduced. Some of you may think, oh, that's the wrinkles, sun damage, and acne. Well, retinol can do that as well. Then what's the difference between Derm Young and the retinol products? Well, there's a huge difference. You may have heard or you may have experienced that using retinol, well, you only use it at night, and then you will get the redness and also dryness associated with the usage. That's because the retinol, while promoting the cell turnover, to get rid of the dark spots, it actually forms a very flimsy skin barrier that can cause sensitivity. However, with Derm Young, so again, two ladies, they like to do the plastic surgery. Without treatment, when we get their cells and we reform the skin with the cells, so we culture the cells, let them to grow into the epidermis. And you can see here, the top part, the skin barrier is very thin. However, with Derm Young Youth Essence treatment, you can see how thick their skin barrier became, and also the cells right underneath the skin barrier is much more organized. So you will have a reinforced skin barrier to ward off the sensitivity. And here is a lady who likes to do, injectables and the radio frequency, and she became very red and sensitive and dry. And she has the redness around her eyes. And after 24 hours use of Illumini oil, which is here, and her redness completely gone. And 3 days later, her itchiness is gone, and the redness elsewhere on her face is gone. And 10 days, she started to use our Youth Essence, and now she's really radiant. So one biggest problem of any topical products is how you deliver the active ingredients. You probably heard about that a lot. And the standard way, no matter nanoparticle, whatever, and is to, strip away. Most of the common way is to strip away your skin barrier, make it thinner. It's like the Pitera in SK2 and the many yeast extract in the yeast extract in many of the products. However, in Derm Young, we have a very different delivery system, not nanoparticle. So this is an illustration of the structure of around pH 2 to 2.5. And what those chemical peels do, it's slough off your skin barrier. So they will come off as a sheet. Very dramatic. However, our Youth Essence is pH 3.5. So what makes the difference? You see the little bars here? They are the connecting rod between these dead cells in our skin barrier. At 3.5, these cells will become like this. And these little gaps will open. So the active ingredients will come here, 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 and then go down to your skin. And then when you, after this, and then you splash on another cream or whatever products, which is normally pH 5 or pH 5.5, that will neutralize this acidity, and then the gaps will close again. So in this way, we are delivering active ingredients without impairing our skin barrier. So you will not experience this rash, the redness, and the dryness. And as I mentioned at the very beginning, people are getting very savvy about the ingredients in the products. So there are a list of ingredients we don't include in any of our products. And I want to highlight that we don't like dimethicone and the silicone compound. The silicone compound are found in 99% of the products. Why we don't like it? Because it can clog pores. It's really bad for acne-prone skin. We try to make something for everyone, so you don't have to think about, this is for oily type, this is for sensitive type, this is for normal type. No, you don't have to think about it. And another reason we don't like this silicone compound is because they can bioaccumulate, meaning they will stay in your skin. And what does that mean? It will just get more and more. What will it do? We don't know. Because we don't know, we don't want to risk anything. That's why it's completely banned in our products. So in front of you you see our current collection. Doesn't look enormous. We don't want to present to you like 20, 30 products that will get very confusing. You don't know what to do. And because everything is so multifunctional, just use the Youth Essence paired with another one. You can address almost all the common skin concerns. Like people in their 50s, I want something to address the loss of firmness and sagging. You can use the Youth Essence and then the vibrancy boosting mask paired with the mist if you feel a little bit dry. And then if you have any sunspot or dark pigmentation, you can use the Youth Essence paired with the illuminating oil. That's sufficient to get rid of them unless they are really, really deep. And we also have protocols for different skin types, for different skin concerns. For example, dry and normal skin. We have had a lot of people with dryness this winter. Even though the cause for dry skin is not clear now, but a lot of those customers have skin barrier issues. Like I mentioned, like the retinol use, impair your barrier, so you are more prone to water loss and then the infection. So to treat this type of skin and also the associated problem like the dull complexation, sensitivity, redness, and the wrinkles and fine lines, we recommend to spray on the hydrating mist, then follow with the Youth Essence. After you apply the Youth Essence, wait for 3 minutes. That gives it enough time for this opening to happen, and then the first batch of the active ingredients to go in. And then you splash on the illuminating oil that will close the gap, and the illuminating oil brings it another batch of active ingredients to come in. And for a weekly treatment, we recommend the vibrancy boosting mask, which has another different dose of active ingredients to see a quick boost of your vibrancy and also hydration, and also give you a little bit lift. So for dry skin, we would recommend to use the vibrancy facial mask overnight. The next morning, you wash it off. Some people, unless you really like to rub, you can wear it as a cream as well. And for oily and the combinational skin, we have to be careful not to clog their pores. So we recommend, instead of the oil, we recommend the pore refining, hydrating and the pore refining fluid, which has no oil, so to take care of the acne problems. Again, this vibrancy boosting mask is good for them as well, but we don't recommend you use it overnight. You can use it for a couple hours and then wash it off. And for very sensitive skin type, we don't know why you are so sensitive. Maybe it's genetics, because some people have eczema or have atopic dermatitis because they have genetic mutation for protein, and that the skin barrier is just porous. So that's, we cannot just look at you and determine you have genetic mutation, but we are normally very sensitive. So what we do is we normally recommend them to start with the oil, to repair their barrier first. And then after a week or 10 days, we start to add on the Youth Essence. And then a lot of people feel a lot better. We actually have quite a few people with eczema using our stuff and see a great improvement. So as I mentioned, we try to take everything we can think of into the design of our products. We really want it to be for everyone. And they really want it to be a very simple regime because, we are busy. We have to do our job, take care of the family and the baby. We really don't have a lot of time to go through 10 steps every night. So basically, everything we offer can be used anywhere on your body, your neck, your under eye, around the eye, everywhere on your body. So instead of paying extra for another eye cream or an extra for your neck cream, that takes care of everything. And also, currently, our customers age range from 16 to 72. This,
earlier, Ms. Dollar bought your product, so now you can say the age ranges to 89.
Okay, great. We just got another boost. Sounds good. And then we do notice, sometimes the kids will steal mommy's skincare products, and the husband will use the wife's product. And so we do take that factors into consideration. That's why the youth essence can take care of the acne as well, for a younger customer group. And also, the men tend to be a little bit more oily and they want something really simple. And that's why a lot of male customers love the hydrating mist, because they can just spray on. That's it, especially in the Georgia hot summer. Right. So, like I would like to put it, I want to be a satellite to send out the waves of radiance to everyone. That's all for my talk, and Serena and I will be happy to take any of the questions you may have. Thank you.